Hi, my name is Michelle Dill, and I'd like to thank you all for attending my speech today. Today we are going to talk about pushing for implementation of EMR. What is EMR? EMR is an electronic medical record system, also known as electronic health records. As you know, we are in the 21st century. So then why do the doctors still insist on using the dark ages of pen and paper? Well, there is a push by the government for an implementation of the EMR system. Right now, I have this document from electronicmedicalrecordsmandate.org, which show the implementation and the requirements. This states that until 2015, they will be giving doctors incentives in implementing it early. After 2015, those incentives are no longer in play, and they will start to be subject to penalties. Now, why would they be pushing it? Well, there's several reasons as to the benefits to it and why they would be doing it. First of which, an EMR system reduces medical errors. It also increases accessibility to the records along with reducing the loss. And it's, quite frankly, cost efficient. Now, let's go over the first key point. How it would eliminate or reduce, at least, medical errors. Well, everybody knows that doctors are known for atrocious handwriting. This, for example, is from my medical record. This is actually something that is pretty decent in comparison to most that I have seen. And in my 15 years of experience, I've seen the worst. If somebody cannot read the doctor's handwriting, there is a possibility that there's going to be a misdiagnosis, an invalid procedure that is going to be done. There's going to be numerous amounts of errors that are going to be made with that. And according to an article that I found by Dr. Jeremy Kaplan, it even states that sloppy handwriting results in more than 7,000 deaths per year. That's per year. That's outrageous. Also, with the implementation, it can also flag duplicate prescriptions or prescriptions that can cause other interactions with other prescriptions. It has been found, as in this article by the New York Times' Ronald Strauss, that an astonishing 37 errors for every 100 paper prescriptions are caused, versus 7 of 100 electronic or e-prescribed prescriptions. That's amazing. It also contributes in reduction of billing errors. If somebody like myself, who has been in the billing field, is trying to review a medical document for proper diagnosis or proper procedure in order to bill the insurance companies, how can you read this? It's much easier to get an electronic record. Now, another benefit to this EMR system is it reduces record loss, and it also increases accessibility. Imagine yourself in a hospital. You're unconscious. You can't tell the doctor whether or not you are allergic to penicillin. Having the access that some hospitals have now with the electronic medical system is they can access your records in one location. They don't have to wait for the doctors to fax in your medical record. It's right there. Also, it reduces loss. I don't know if any of you have been in a situation as me, but I've been in many companies where you're trying to locate a record and that paper file is filed within other patients' charts, or it's just completely lost or damaged. That reduces it because you can locate it in a computer data system. Finally, we have, it's cost efficient. I mean, yes, electronic medical record system is very expensive to start out with, but the cost overall is very efficient. For one, once it's implemented, you are able to save money in payroll. You don't have to have those people that are required to maintain your medical records. You don't have the paperwork that's required for it. You can save on patient folder tabs and folders. It's a no-brainer to me. The loss of money that goes into it is enormous with the amount of money that you have to spend in order to maintain your paper system. So let's go over the key points. Again, what are the benefits? Benefits is it reduces medical errors. It is a reduction in record loss, and it is very accessible, and it's cost efficient. And right now, as according to the CDC, in 2012, they mentioned that 72% of office-based physicians are using the electronic medical system. That's awesome. That's a good start. But we need to push for the rest of the percentage of doctors' offices to get on board. This is a no-brainer. Let's get the ball rolling, people. So that's it. And I thank my audience for attending. I appreciate your time. And again, I hope you enjoyed my presentation. Thank you.